do their jobs, which are vital for public safety and to make sure that other families can get the food and gas and pharmacy goods that they may need. Our essential workforce deserves to know that their kids are safe and cared for in a small and affordable group setting. I'm proud that here in Illinois, effective April 1st, all essential workers in healthcare, human services, essential government services, and essential infrastructure now qualify for the state's Child Care Assistance Program, meaning that the state will cover most, if not all, of the cost of care with our emergency child care providers. That includes everyone from nurses and doctors to support staff in hospitals to grocery store clerks and food producers. If you are an essential worker, full details and applications for assistance are available now on our Illinois Department of Human Services website and our state COVID-19 response website. That's at coronavirus.illinois.gov. When our stay-at-home order first went into effect and traditional child care centers temporarily closed, I announced a new emergency child care center license for providers, interested organizations, and parents and guardians within communities to increase the availability of safe, small group care for the children of our essential workers. As of this weekend, over 550 centers are running under the emergency child care permit. Additionally, over 1,500 home child care providers have reported that they're still providing care, many of them on the critical night and weekend shifts that are so important for our essential workers. I cannot stress enough the difference that all of these providers are making in the lives of not just the families that they serve, but all Illinoisans. Here's just one example of a center's impact. In Harvard, Illinois, in McHenry County, there is a Gold Circle of Quality certified daycare and learning center called Brown Bear, run by a remarkable director, Sheila Henson. Sheila has Brown Bear operating from 6 a.m. to 5:30 p.m., caring for the children of Harvard's community members who work in local grocery stores, on farms, and in the local milk processing plant. Sheila is not only providing an important benefit for those workers, she's also making it possible for everyone else to get milk that they process at that facility and the food that they produce. Nearly everyone in Harvard ought to be grateful to Sheila Henson. That's true for our home providers, too. In East St. Louis, Tina Branch Williams runs a home center caring for 6 children during the day and 5 others at night, making sure that the healthcare workers and first responders in her community have the support that they need. These emergency child care providers are just another example of the incredible ways in which Illinoisans have stepped up to maintain normalcy where we can, while we take up the fight against COVID-19. Honestly, we can't thank them enough. Last week, we announced that we were providing one-time stipends to providers to soften the financial impact of this crisis. Already, over 1,100 homes and centers have applied, and those who haven't yet can do so now by contacting their local child care resource and referral agency or by downloading the application from our coronavirus.illinois.gov website. We also made sure that our Preschool for All grantees and Prevention Initiative grantees had the flexibility that they needed to use grant funds to address emergency child care needs in their communities. Unfortunately, the federal Head Start program has actually done the exact opposite, making it very difficult for Head Start programs to use their staff or facilities to respond to the needs of non-Head Start families in their communities who may need care. I've urged the federal government to take a hard look at what we're doing here in Illinois and reconsider how they're operating Head Start until we get through this current crisis. Today in Illinois, we're building on our support for emergency child care centers, helping out the ones already running and hopefully encouraging others to join. We will be paying enhanced reimbursement rates for emergency child care effective April 1st of 30% above the rates that we usually pay to reflect the additional costs of providing care in smaller groups. Child care centers that are interested in reopening as emergency centers can still apply for a permit through the Department of Children and Family Services. Finally, I want to address the health of our state child care landscape for when we cross the finish line of our fight against COVID-19. By and large, child care in this country is a high-risk, low-revenue business with razor-thin margins. The people who run our centers and homes do so because they love to be there for our kids and our families. We know that we need to provide support to those programs that have had to close during the stay-at-home order, as well as those emergency centers who aren't able to operate on the same scale as normal. I want to take a moment to acknowledge our Office of Early Childhood Development here in Illinois for their creativity in responding to this crisis. In large part because of their work and ingenuity, Illinois is being recognized on a national level for its leadership in responding to the needs of its early childhood and child care system in this crisis. Already we've created a simple waiver process that allows child care providers to be paid for all of their enrolled children in the Child Care Assistance Program for March and April, so that the child care staff could continue to be paid as normal through this unprecedented period. Doing this ensures that our child care staff are able to put food on the table and to care for their families so that they're ready and waiting to welcome kids back into their care when this is all over. The Governor's Office of Early Childhood Development is providing a webinar tomorrow morning on Monday to help providers learn about what is available. Providers interested in tuning in can find registration information again on our state coronavirus website, coronavirus.illinois.gov. I want to thank you all for joining us this Sunday, this Palm Sunday, and I'll turn it over to our Department of Public Health Director, Ngozi Ezike. Doctor?
Thank you, Governor. And as you've heard, the Governor is very interested in the welfare of the children and the people who take care of them, as he is for every resident in the state of Illinois. And I just appreciate and thank you for your dedication to everybody in the state. Good afternoon and happy Palm Sunday, yes, to those who are celebrating across Illinois. As a person of faith, I know how important these days are, as well as other important days like birthdays and anniversaries. Please know that you can still celebrate your faith and you can observe special days like today or like birthdays, but while at home. I urge faith leaders to continue hosting services online. We need and want everyone to stay home. Once this pandemic comes to an end, we'll all be able to worship as previously and celebrate our treasured milestones together. We do have to do things differently because we're fighting an enemy that we've never seen before. Today, the Illinois Department of Public Health reports 899 new cases and another 31 losses of life. This brings our statewide total to 11,256 with 274 deaths. Among those lost is a second individual from the outbreak at Stateville Prison. This individual was at a local hospital. There are currently 60 positive cases at this congregate facility. You all know, like I know, that these numbers represent people. They represent our fellow Illinoisans. We should continue to do our best and keep everyone safe by staying home, washing our hands, and physically distancing. These three simple actions can keep you and your loved ones healthy and ultimately save lives. IDPH and local health departments are working around the clock, ensuring that communities and facilities don't become inundated with cases by getting out timely education and providing technical assistance when needed. All of this so that we can flatten the curve. Much attention has been given to the data we have shared regarding the race breakdown on our webpage. About 30% of positive cases are African American. We know all too well that there are general disparities in health outcomes that play along these racial lines, and the same may be true for this virus. We have worked to ensure that all of our communities can access the health care they need as COVID-19 spreads, and we will make sure that resources are directed where they are needed most. Even before this pandemic, we have worked tirelessly to address the health disparities that exist among our Black and Brown communities, and that work to expand access to care in our underserved communities will continue both now and long after this pandemic has been conquered. I understand the safety precautions that we take and that we're asking everyone to take are unprecedented. I cannot stress enough how serious we must take this situation. Many people are complying, and to them I say thank you. To those still feeling like they have to take the entire family to the grocery store, please reconsider. There's no need for everyone to be out there because we are all at risk. I began my remarks yesterday with a plea for everyone to stay home, and today I end with that exact same plea. Stay home, protect yourself, protect your community. We will get through this together as one Illinois. And now I will summarize comments for our Spanish-speaking population. Buenos tardes. Feliz Domingo de Ramos a los que celebran hoy. Soy una mujer de fe, sé que importantes son los días como hoy por mucha gente. Igualmente importantes son los aniversarios, los cumpleaños y otras fechas. Quiero que todos tengan en cuenta que pueden celebrar su fe y observar días especiales como cumpleaños mientras están en casa. Pido a los líderes religiosos que continúen servicios por Internet, si es posible. Queremos que todas se queden en casa. Cuando esta pandemia llegue a su fin, todos vamos a celebrar todos estos días juntos. Ahorita es un tiempo especial a causa de este virus, pero eso necesitamos hacer cosas un poco diferentes. Hoy, el Departamento de Salud Pública aquí en Illinois informa 899 casos nuevos y 31 muertes conectados a COVID-19. Esto eleva nuestra total a 11,256 con 274 muertes. También estamos anunciando una segunda muerte en Stateville. Esta persona estaba en el hospital. Tenemos 63 individuos en aislamiento, 49 son COVID positivos y 14 todavía están bajo investigación. Ustedes saben, como yo sé, que esos números representan personas, representan a sus compañeros de Illinois. Debemos continuar haciendo nuestro mejor esfuerzo y mantener a todos seguros y quedarnos en casa, lavarnos las manos y distanciarnos socialmente. Estas 3 acciones simples pueden mantener a usted y su familia saludables y, más importante, salvar muchas vidas. IDPH y los departamentos de salud locales están trabajando las 24 horas para garantizar que las comunidades y los hospitales no se inunden con casos de COVID-19. Entiendo que las precauciones de seguridad que todos debemos tomar no tienen precedentes. Muchas personas están cumpliendo y les agradezco. Para aquellos que todavía están tomando las compras de comestibles de toda la familia, ya no lo hagan, por favor. No hay necesidad de poner en riesgo a toda su familia. Comencé mis comentarios ayer con una petición para que todos se queden en casa y hoy termino con el mismo motivo. Quédense en casa, protégese y protege a su comunidad. Vamos a salir de esto juntos como un Illinois. And with that, I will turn the podium over to Governor Pritzker.
Thank you. Happy to take any questions from members of the media.
Thank you, Governor. Mike Puccinelli with Channel 2. So the AP is out with a study today that essentially says the federal government wasted months before even beginning to place bulk orders for supplies like N95 masks and ventilators and such, which happened in mid-March. What are your thoughts on that?
Well, we now know that the federal government had intelligence briefings, they had memos, they had advice from their medical advisors all the way back in January. And we knew in February, many of us, just watching the television, let alone what intelligence agencies knew, that this was overtaking parts of the world that were clearly coming toward the United States, and people are traveling to the United States. And so the idea that the United States federal government did nearly nothing for quite a long time is now being visited upon us. And I've said this over and over again, that if action had been taken earlier, a lot fewer lives would be lost. Today, we're all competing against each other. States one against another, federal government competing against states, other countries competing against states. For us to try and save the people of our states, to try and protect the healthcare workers and essential workers and frankly, everybody from this virus. And it is wrong. It's just wrong what's happened. And I'm very, look, I know people know I'm upset about this. Sometimes I feel like I've said it every day because I feel it every day. But if you could experience the frustration of trying to get PPE when you're competing against the very people who are supposed to be your allies in this, you would understand why this bothers me and why I express myself in the way that I do. I've been a lot angrier at moments with people who aren't helping at the federal level. I've tried to hold it in check. I'm not somebody who likes to express anger in that way, but I have, unfortunately, during this process been quite angry, and I will fight for the people of Illinois, and I will say what I need to say and do what I need to do to protect them.
How worried are you hearing that, according to the AP, the Strategic National Stockpile is nearly drained right now?
I'm very concerned, but I've given up on the federal government, honestly, really showing up in the way that I think we all would have expected them to. It's called the Federal Emergency Management Agency for a reason. That's a federal stockpile, a national stockpile for a reason. Remember, you wouldn't have a federal emergency management agency. You wouldn't need one, right? If you thought that state emergency management could manage through, massive disruption. Right? When there's a major hurricane, think about Hurricane Katrina. It had to be the federal government that would step in. It was too big. You don't think this coronavirus, this COVID-19 is too big for states? It is. That's why you have a federal government. So the idea that the Strategic National Stockpile, look, I understand. Nobody could have predicted what happened here, perhaps, or very few people. On the other hand, they had this information before the states did, and should have been out there exercising the Defense Production Act, acquiring PPE, acquiring ventilators, and then we wouldn't be in the situation that we're in today where everybody is short of ventilators.
Two other quick things, and then I'll hand it over to Will. The Surgeon General said that he expects this week to be like a Pearl Harbor, like a 9/11 in America. Is that what you're expecting?
I guess I wouldn't have used those words, but this is, I want to say that this is happening on a rolling basis in different areas of the country. So it's not all happening at one time everywhere. But it is all going to happen in a relatively short period of time, meaning perhaps over 6 to 8 weeks across many areas of the country. And so I do very much worry about all of the people of the United States, and especially in areas, very highly urban areas where the virus is spreading fast, as well as, the many people who live in rural, ex-urban, and suburban areas who I sometimes think that this isn't coming to them, but you've seen, look at the map of the state of Illinois. People, when there was one county that was being affected, people said, well, it'll never touch me. Now we're at 70 counties out of 102, and I can almost guarantee you when we're all said and done here, all 102 counties are going to have cases.
One final question from me. What about businesses? We're getting a lot of questions from people who are confused, business owners too, who say, are there rules in place, and exactly what are the rules governing how a business should operate when they suspect that there might be COVID-19 cases within their workforces?
So first, again, the rules, as people are asking for, certainly could not have existed before we got into the situation of needing a stay-at-home order and needing to shut down non-essential businesses. And so we're talking literally, although it seems to many people, including me, as if this has been going on for months and months. It's, the stay-at-home order went in place March 21st. And we borrowed from the federal government the definition of essential businesses, what would need to happen in an emergency, what you would need to have open. And that's how we started to put together our stay-at-home order for the state. But I think the rules are being written as we go here. I mean, you've seen that. We've had to evolve as we learn more. And so we're going to continue to try to set those rules. We're going to continue to try to work with businesses, with workers, to make sure that things are done in the right way. But as I said yesterday, any businesses that are forcing their workers to come to work when they are ill, those people, we've got to raise attention about that, and we should go after them and make sure that businesses are doing the right thing. Yes, sir.
Hi, Governor. Will Jones from ABC 7 here in Chicago. My first question is about those stats involving our African-American population here in Chicago. When they hear that there are 30% of these cases and they only represent 14% of the population, is there a plan in place to address this health disparity?
So just to repeat for everybody, although you've got the microphone, the health disparity that's, evident in some of the numbers that's affecting the African-American community to a greater degree than others. It does start out, as Dr. Zike indicated, it starts out with the disparity that has already existed in healthcare provision for people of color. We already started out with an unequal system of healthcare for people, and then it gets massively exacerbated when you bring on something like COVID-19, which clearly requires an enormous amount of healthcare provision. So I'm deeply concerned about this. I've seen these stats not just for Illinois, but also for Michigan and for a couple of other states where it's also true. And what I can tell you is that by opening the Metro South Hospital, as we are intending to do, by opening the Westlake Hospital, as we are intending to do. Those are two examples, anyway, of hospitals that are in communities of color, that are serving communities of color, that were closed over the last year or two, that we want to make sure and reopen and provide health care for people. So that's one way in which it's being addressed, but it is a much broader problem that over the course of 3 or 4 or 5 weeks here where we've been dealing with this pandemic, that it's hard to make up for decades, frankly, maybe centuries, of inequality of application of health care to people of color.
So what would you recommend to the black population in the state? What can they do to protect themselves? And I know you kind of touched on this, but is there something that you can do in the short term to make sure we're saving lives in this state?
There are things that we can do, and that's what I want people to listen to. Look, this pandemic, this disease, this virus, doesn't discriminate. It doesn't. It affects anybody that it comes in could affect anybody that comes in contact with, not one person based on color or not. And so the one thing you can do that everybody can do is stay home. Make sure that you are wiping down surfaces. We've said it over and over and over again, but this is true for everybody, no matter the color of your skin or where you're from. Got to wipe down the surfaces. You've got to wash your hands. You've got to make sure that you're careful even when you go grocery shopping. Keep 6-foot distance between people, and I know that's hard to do sometimes. Wear a mask. You saw me walk in with a mask today. I've been wearing a mask when I go out I did this morning when I was out, and I did it, as I came here. People should wear a mask. People should make a mask if you don't have one already, and make sure that you're keeping social distance and following all those rules, because actually that is how you can prevent yourself from getting COVID-19.
One more question on this subject, because I think it's very important. This is for the doctor. I know WBEZ is reporting that 70% of the deaths here in Chicago related to COVID-19 involves black people. Can you confirm that?
Thank you. That is important information, and I want the people to have the most accurate information. Every Tuesday, we will be giving the last Tuesday is when we gave the last demographic information. We want to compile a week's worth from the last and give that on Tuesday.
All right, and I'll give you one more question in the room, and then we got to get to some online.
Okay. We're still getting a lot of complaints from essential workers, specifically in healthcare, about not having enough equipment. What would you tell someone in your family if they were involved in healthcare and they're not having the proper equipment to do their jobs and stay safe and protect their families?
The equipment, by all of the measures that we use, the equipment exists at those healthcare facilities. And so if it's not being provided to you by your employer, they have it. Because we check on the stocks at every one of these healthcare institutions. They have the ability to call us anytime they're running low in any way. They can call their county public health boards to get PPE. We've been acquiring PPE and pushing it out to every county in the state of Illinois, and directly sometimes to the hospitals. Here in the city of Chicago, the city has a stockpile of its own PPE that it is responsible for pushing out to the hospitals in Chicago. And by all measures, they have reported that every hospital has what it needs in the immediate term for every person that works in a healthcare facility. So if people are not getting it, it's not because it isn't on site. And so they should insist with their supervisor or with higher-ups at those healthcare organizations that they get the proper PPE. But I think we all know that that if you're treating COVID-19 patients, and even if you're not, and perhaps in an adjacent ward or something where you're being exposed to COVID-19 patients in any way, that the PPE, N95 masks, surgical masks, other PPE that people can wear is exactly what we've provided there. So it is available. They should wear it.
We got one question from Univision.
Yeah, this is from Erica Maldonado. She wants to know, why isn't Illinois putting tougher measures in place, like perhaps no one on the streets after 7 p.m., or perhaps why not only one person per family, 1 day a week, depending on the last name of that family, for example?
These are all measures that potentially could be put in place. There's no doubt there are other things that we can do as well. In South Korea, just to give you one example, everybody that walks into a grocery store, before they walk in, their temperature is taken. And when you came into this building, your temperature was taken here at the State of Illinois building. That's something that I think is a very interesting idea, something that I've looked at and have considered. And, as we move along here, you've seen we've tightened and tightened, wherever we thought we could. So these ideas that are being brought up by Erica Maldonado are perfectly good ideas. We could do those things. I think what we're seeing is people are, for the most part, the vast majority of people are abiding by our stay-at-home. They are doing the right things. But we will continue to look at what is possible, what is likely, and how we would enforce those things.
Could this pandemic or others come around again, and this disruption of people's lives and health would be every few years possibly?
Well, there's no doubt that, a single virus pandemic, even if we overcome it, when we overcome it, doesn't mean that there couldn't be another one. So that is absolutely true. In the federal government and state governments, no doubt this was a massive, red alert to everyone that this could happen, and it could happen with a much more severe virus potentially. So we've got to rethink, I think, everything about healthcare so that we can be prepared for the potential of a pandemic in the future.
Are there any criteria or data points that could lead the governor to impose tighter restrictions than those that are currently in place, and what might those look like? Or is this literally all the state can do right now?
Well, as indicated by an earlier question, there certainly are more things that could be done. As you know, we were first, and I think very strongly so, to put in place many of the measures that we have today. We were either first or among the first, I should say. The second to put a stay-at-home in place. Now it's, I think, 98% of the population of the United States is under a stay-at-home order. I can review everything that we've done, but we were among the first, and we did it early. And I will continue to look at every measure that we could take. We're trying to defeat this virus. There's no doubt about it. We're trying to give the healthcare system the ability to swallow all of the challenge that comes from all the people who are sick. I'm praying as I look at the potential for peaking in the next couple of weeks that we'll be able to manage through this with the resources that we have. But I'm not, fully confident of that, and that's why we spend every day trying to obtain more PPE, trying to make sure we have more beds available to us, trying to make sure that we're doing everything we possibly can so that when we do peak and start to see us coming off of a peak, we'll be able to say, well, maybe we prepared too much. That would be my dream, that we did too much to prepare for this.
What are you doing to keep downstate legislators up to date on the decisions impacting their constituents?
So I have a call with legislators across the state, one on Tuesday, one on Friday. We talk to mayors, also other leaders, and I make sure and give them all the information that I have available to me so that they can better inform their constituents and they can help us, frankly, with the ideas that they have. And they call every day, just so you know. I have a staff, what is normally a legislative staff dealing with legislation, that is taking calls from legislators and trying to answer questions that they have and for their constituents. And, we're doing the best we can to get to everybody every single day. I think we do a pretty good job of it.
What do you say to the Iowa governor who has no stay-at-home order, or Wisconsin's governor who is still planning on an election in spite of their stay-at-home order? Have you talked to those governors?
I have not talked to the governor of Iowa. I do communicate with the governor of Wisconsin on occasion. I mean, I've talked to quite a number of governors, just so you know. I really believe that governors that haven't taken the kind of action that we did or took it much later than we did unfortunately, they have been listening to President Trump and his advice. And his advice has been, first it was, this is a hoax. Then it was, this is just like the flu. This will go away in a few days. I think many of them were listening to all of that while the president was not taking this very seriously. I think now that he is taking it seriously, many of them have moved toward more stringent orders. And I'm sure that the governor of Iowa is considering more that she could do. And I hope that she will, because when you consider that much of our border in the state of Illinois is Iowa and Missouri, and Missouri only just recently, I think 2 days ago perhaps, put in a stay-at-home order. Remember, this virus knows no borders, so the fact that people in Missouri were not under stay-at-home, people in Illinois were, means that people in Illinois, on the Illinois side, let's say, of the Metro East area near St. Louis, you can see there is a hotspot of people who are getting coronavirus, who are getting sicker and in the hospital, who are near St. Louis. And I'm glad that the governor of Missouri was able to put in and did put in a stay-at-home order. I'm hopeful that the governor of Iowa will too.
This will be our last question. Dr. Ezike, a record number of Illinois residents saw their jobs yanked from them, and there isn't a clear date if or when they'll get them back. Does IDPH have any way to measure the mental health impact to them and the millions who say they feel isolated?
I think we know that that's a significant issue, and I know when I talked to Secretary Grace Ho of the Department of Health Services, we know that the work that's going to have to be done between our agency and her agency will just be exponentially more in terms of the amount of mental health decompensation and amount of social services that will be needed. And so our agencies, of course, along with other sister agencies and so many agencies, they're already trying to mitigate some of the damage that's being done. We know that we'll continue to be working overtime, not just now, but even months and years after we get on the other side of this, to kind of repair so much that will be undone from the current situation.
I'd like to add one other thing. I'm sorry. I think sometimes people mistake when I am being critical of the White House or the president. They mistake that for me being critical of the people who are helping at the federal level. The Army Corps of Engineers has done a superb job for the state of Illinois. The Army has come in and they've met with me a number of times. They are putting their personnel forward. They're working with our Illinois National Guard, who are the best in the nation, to make sure that we're building out the facilities that we need to. And FEMA, the FEMA officials that we deal with here in our region, and the HHS officials, all are working very hard. They live here in Illinois, most of them. And so they want this to succeed for them and for their families as well as for all of us. So I am grateful for all of the help that we get from those federal employees who work day and night really to protect the people of Illinois. And so my criticism has been the lateness of the policies decisions that have been made by the leaders, and therefore the lateness of any help that we have gotten, which has been due to the people who are above the people that I just described, and their unwillingness to make good decisions that work to the betterment of everybody in Illinois.
All right, thank you.
Thank you.
This is our, I have to look, but it's at least a month, I think. Yeah, I'll get it. I just have to look.